Namaskar. I am Dr. Sagarika Mukherjee. I'm a consultant endocrinologist based at Kolkata. I shall be talking about how diabetes is related to dementia. Diabetes is increasing globally mainly because our food habits are changing. We are becoming more inactive than our forefathers used to be. Population is aging as well. Diabetes is very closely related to heart disease because diabetes tends to affect not only just your blood sugar level but actually it affects the blood vessels in the body. Both tiny and large blood vessels of the body gets affected, and because of this reason diabetes patients have got increased risks of having heart attacks, problems related to their feet, problems related to kidneys and eyes. And this is the same reason why diabetes patients, because the blood vessels gets affected in the brain as well, are very much prone to get strokes. One of the causes of dementia is to have mini strokes, which may not be recognized very apparently, to have a number of mini strokes over a prolonged period of time, which leads on to certain remodeling inside the brain, and which affects your power of thinking, your ability of concentration, ability to learn, ability to communicate, which ensures as dementia. Not only this is called vascular dementia, but diabetes has been associated with Alzheimer's dementia as well. Now, how can Alzheimer's and diabetes can be related? There is an abnormal factor called insulin resistance which builds up in the body for type 2 diabetic patients. Now, what is this insulin resistance? This insulin resistance is an abnormal factor which doesn't allow your own insulin to work on your own tissue, that is, utilize your glucose, allow the glucose to enter the cells. Insulin is the key factor which makes the glucose to enter into your cells and work on the metabolism. So insulin resistance prevents your insulin, your own insulin, to work on your cells and therefore enter glucose into inside your cells to keep on with your metabolism. The same thing happens inside the brain as well. The brain is very much dependent upon glucose. So if there is a lot of insulin resistance is building up in the body, there may be some degree of insulin resistance inside your brain as well, and therefore which is preventing the brain tissues taking up glucose, which can, and because if brain tissue get deprived of glucose, deprived of nutrition, can lead to remodeling and changes inside the brain cells, which can later on get manifested as Alzheimer's disease. This has been brought about by a research from Mayo Clinic in the USA, and there are several researchers globally as well who is looking into how diabetes can be directly associated with Alzheimer's disease. It's been also said that because of for Alzheimer's to happen, there is another abnormal protein called amyloid which gets deposited in your brain. Now, you require some amount of insulin for amyloid, to prevention of amyloid formation, and in type 2 diabetes patient, because of this relative lack of insulin, there is amyloid deposition in the brain. Not only this, there is another abnormal protein, or one of the crucial proteins involved in Alzheimer's disease is called the tau protein, which communicates between the cells inside the brain. And what it happens, the tau protein gets entangled within the neurons and creates abnormal deposits in the brain, which can lead on to Alzheimer's disease. Now, this disease process doesn't happen in a day, it doesn't happen in a month, it doesn't happen in few months. It takes years and years and years to develop. The changes are extremely slow. Researchers are now looking into whether age of onset of your diabetes tends to affect the development of Alzheimer's. There's a large scale study being done, one in Scandinavia, one in the US, which is looking into several factors like age of onset, family history of diabetes, history of medications, their dietary history, etc., to see that whether these are the factors. This study is being done over a prolonged period of time to see what are the effects of on your brain these factors can do. So therefore you can see that this is related over a prolonged period of time. So one way to prevent Alzheimer's happening or dementia happening in type 2 diabetes patient is to keep your diabetes under control. So what are the things that you can do? You can maintain a healthy diet. Saying is that if your diet consists of a lot of fibers, moderate amount of protein, low amount of fat, it is considered as a very, very healthy diet. Your calorie intake should be in keeping with the total amount of calorie output, that is total amount of physical exertion that you're doing. So if you're not going to overeat, then you're not going to become obese, and your chances of having developing diabetes will also can be prevented if you can prevent obesity. That's number one point. Second point is to keep yourself very active. Now if you are engaged in physical activities, that is either running or jogging or cycling or any form of say exercise, yoga, etc., which involves the use of your muscles, which involves like increasing your heart rate, making you to sweat, so these forms of aerobic exercise are also extremely good for you. Third most important factor is if you have at all developed diabetes, to keep your diabetes under full control, and which will help you in the long run as well. Now keeping diabetes under full control means that you may be prone to getting hypoglycemia. Hypoglycemia means low blood sugar, because very, very intense therapy with diabetes can cause hypoglycemia. Now hypoglycemia is also one of the risk factors for dementia or even Alzheimer's disease to develop in diabetic patient. Patients with diabetes who are prone to recurrent hypoglycemia may in the long run have some form or the other of brain damage. So make sure that your diabetes treatment is such that it will keep your blood sugar under control but will not make you go hypoglycemic at all. And the most important factor is engage in social activities, engage in relating to each other, engage in conversation, listening to music, keeping your brain active, so that you can prevent these form of deadly problem of Alzheimer's, which take years to develop, and once it's developed it becomes really, really very hard, not only on the person as say, but as well as the caregivers, as well as the family members of the Alzheimer's patient. If you have liked this video, do share please, and please let me in your comments that whether you would want to know a few more tips about how to take care of a diabetic patients who've already got dementia or Alzheimer's dementia. I shall be more than happy to share my few tips regarding how to take care of such type of patients. Thank you very much for logging in. Thank you very much.